Metronidazole is an antibiotic and antiprotozoal medication commonly used to treat a variety of infections, especially those caused by anaerobic bacteria and certain parasites. The mechanism of action of metronidazole involves disruption of microbial DNA, leading to cell death. Metronidazole is a prodrug, meaning it needs to be activated to exert its effects. Inside anaerobic organisms or protozoa, it is reduced by microbial enzymes, like ferredoxin. This reduction process generates nitroradical anions, highly reactive molecules. These radicals interact with DNA, causing strand breakage, loss of helical structure and inhibition of nucleic acid synthesis. The DNA damage is irreversible and leads to cell death. Metronidazole is only active in anaerobic conditions because oxygen interferes with the reduction process, so it's ineffective against aerobic bacteria. Doctors often prescribe metronidazole for intra-abdominal infections like abscesses and peritonitis, skin and soft tissue infections, pelvic infections and gynecological conditions like pelvic inflammatory disease, and dental infections, including acute necrotizing ulcerative gingivitis. It also treats several protozoal infections such as amoebiasis, giardiasis, and trichomoniasis, a common sexually transmitted infection. In women, metronidazole is a first-line treatment for bacterial vaginosis. In surgery, it's used as a preventive antibiotic, especially for operations involving the colon or reproductive organs. Finally, while not a first choice anymore, it's sometimes used for Clostridioides difficile infections. Like all medications, metronidazole can cause side effects. Common side effects include nausea or vomiting, a metallic taste in the mouth, loss of appetite, stomach cramps or diarrhea, headache or dizziness. Less common but more serious side effects may include numbness or tingling in the hands or feet, known as peripheral neuropathy, seizures or confusion in rare cases, severe allergic reactions, such as rash, itching, or difficulty breathing. Another important note: do not drink alcohol while taking metronidazole. It can cause a dangerous reaction, nausea, vomiting, and rapid heartbeat. Now, we will make a simple and fun mnemonic that will help us retain all these crazy pharmacology facts. Okay, so a lush garden scene with a giant metronome towering in the center, symbolizing metronidazole. Nearby, a giant clear fishbowl sits on the grass, filled with water and decorative figures. This will represent anaerobic bacteria. Inside the bowl is a closet, for Clostridium. Flying high is a helicopter, for Helicobacter. A plastic milkman statue is there to represent Lactobacillus. Next to the fishbowl, a gardener works tirelessly. He represents Giardia, but his efforts are in vain as a giant amoeba, for Entamoeba, and a hungry cartoonish Triceratops, for Trichomonas chews on petals. Beside the gardener lie empty beer bottles, symbolizing a disulfiram-like reaction. In the background, a visibly angry pregnant woman stands scolding the gardener, representing metronidazole's contraindication during pregnancy. And that's metronidazole. Just remember the mnemonic, and you'll never get tricked by this antiprotozoal again. Stay smart, stay safe, and I'll see you in the next med tale.